Well, good afternoon and welcome to sunny White Center. I'm King County Executive Dow Constantine, and this is a community I was proud to represent as a member of the Washington State Legislature for several years, as well as King County Council member. It's home to so many working families who contribute so much to our region. One of my core commitments as your executive is to build equity and social justice in our region. And nothing builds equity more than ensuring that children are born healthy, that they have the opportunity to fulfill their potential, and that women and families are healthy and have access to the right services. The research is clear. Communities are healthier when women are healthier. And all people of our region, men and women, regardless of income or zip code, deserve to receive critical health services. 83% of the clients here at White Center are non-white. 93% earn less than 200% of the federal poverty level. Public health services are funded largely by state and federal grants. And that's why it was so unjust and unfair to see those funds cut again and again by the state and federal government. Actions that are beyond the control of us here at the local level. We've worked hard to keep our public health clinics open year after year, despite declining funding and without adequate funding authority of our own here at the local government level. We kept the doors open until the last round of cuts this year. This clinic was reluctantly proposed for closure, which would have had a devastating impact on the health of women and children and families, not just here in White Center, but throughout West Seattle and Burien, SeaTac, and Tukwila and Des Moines. But despite all of this, I have some good news for you. I am pleased to announce that in the budget I will send to the County Council next Monday, I am going to keep the Greenbridge Health Center open. We will make sure everyone continues to receive the critical health services they need, thanks to an innovative partnership between King County, the City of Seattle, and Planned Parenthood. Planned Parenthood, which is nationally recognized for improving women's health, will provide family planning services here. Seattle Mayor Ed Murray has proposed to commit $400,000 of City of Seattle funding for 2015. And Public Health will continue providing WIC and maternity support services for more than 7,000 people here this year. This is a new paradigm we've brought to King County for much more challenging times. Not simply going it alone or not at all, but seeking innovative partnerships across the range of our responsibilities. And I will keep working with cities and with community partners elsewhere across the county to develop similar opportunities to preserve public health. I want to thank my longtime friend, Chris Charbonneau, a fellow West Seattleite, for joining me in this new collaboration. I want to thank my longtime friend and former legislative colleague, Mayor Ed Murray, for demonstrating his commitment to preserving regional services here at Greenbridge. And it's my pleasure to introduce yet another longtime friend, Seattle Deputy Mayor Heok Kim.
Thank you so much, Executive Constantine. On behalf of Mayor Ed Murray, my name is Heok Kim. I serve as one of his deputy mayors, and I just want to say in the first 8.5 months of the new mayor's administration, he has been particularly appreciative of the incredible embrace and welcoming that he has received from County Executive Dow Constantine to work on these and other important issues. On behalf of Mayor Ed Murray, he is pleased to, like the county executive, to propose some investments in his 2015-2016 budget that he will be releasing on September 22nd, the same day as the executive will be announcing his budget proposal. And those included in the mayor's proposed budget will be a series of investments, strategic investments for 2015 that target public health necessities for the betterment of children and families throughout the city of Seattle. It's a partnership reflected, I think, by today's press conference that is integral to Seattle's relationship with King County that we have to maintain. And as evidenced by today's press conference, a collaborative partnership that we must now embrace with some key leaders in our public nonprofit sector. Healthy families, healthy children, healthy infants are absolutely vital to the future sustainability of the city of Seattle and our entire region. And so the investments that Mayor Murray is releasing today and which will be shared as part of his comprehensive budget proposal next week are really a small fraction of, I think, the totality of investments that the city of Seattle and King County need to make, continue to make in important communities like White Center and West Seattle. I have the pleasure now of turning the mic over to another leader who has been fighting for many years, both in the legislative arena and now on our King County Council, for issues around equity and social justice. Today, we may be talking about public health investments, but at the end of the day, if we can't understand and get a grapple on equity and social justice in our entire region and our city, then we are going to be failing hundreds of thousands of children and families all across this region. And we could not have a better champion on the King County Council than King County Council member Joe McDermott.
Thank you, Hayok. As the King County Council member representing White Center, and as the chair of the Seattle King County Board of Health, and having had the pleasure of representing White Center in North Highline for 14 years now, I truly know the importance of the Greenbridge Public Health Clinic to this neighborhood. This community is unique. North Highline's affordability has historically made this neighborhood a gateway for immigrants and refugees who have arrived, settled, started businesses, enrolled their children in schools, joined churches, and raised their families here. This is a neighborhood where diversity is celebrated. White Center families are from many different backgrounds: Latino, Vietnamese, Cambodian, Somali, and Samoan, to name a few. And our public health staff helps them navigate important issues like nutrition, breastfeeding, physical activity, and reading. These are important components of families raising healthy babies and thriving young children. More than 8,500 women and children use Greenbridge every year at this beautiful location redeveloped by our colleagues and partners, the King County Housing Authority. Not only do women and children find family planning services, which will now continue thanks to Planned Parenthood, but also WIC and maternity support services. These programs help match expectant and new moms with professional nutritional, medical, and mental health support. WIC and MSS have shown to reduce low birth weights, which significantly reduces the likelihood of infant mortality. I really want to thank the City of Seattle for partnering and their increased support of public health. It really has made the difference here at Greenbridge, as we announced today, and will make a difference for the community as well. It's now my pleasure to introduce another key partner, Chris Charbonneau, the President and CEO of Planned Parenthood of the Great Pacific Northwest. Chris, thank you.
Thank you. I so appreciate we have the county council that we have and the mayor's office that we have. As you just heard, Planned Parenthood of the Great Northwest is going to assume the management of this family planning center The way we're going to do that is that we are going to fold our West Seattle Health Center, is a few blocks up that way, into this one, make one larger center, use the money that we're not paying for rent twice to make this work, take a little bit of a burden out of the county budget that way, and see twice as many people basically in the space. We're incredibly excited to be partners in doing this with our long-term partners at the King County Department of Public Health. We have been providing family planning together in tandem for this city and county for about 50 years. I've loved having them as partners in doing this. We've sort of divided up where we were. Unfortunately, lack of revenue makes that a very difficult challenge now. So we just put smart people in a room and said, how can we make sure that we attend to the reproductive justice that is required in this neighborhood by ensuring that this health center that serves so many people who are new to this country don't go without services. And we felt that we could do an innovative thing by folding these two organizations together in order to make sure that it kept happening. And I'm delighted that we will have the support from the county for the WIC and maternal services that go with it, to be sure that the things that Planned Parenthood does not do are provided by experts who have done it for all these years, and that we can do it as their partners. So we're very excited about that. Quite clearly, we're qualified to run a family planning health center. We serve about 150,000 people in 3 states, from Fairbanks to Twin Falls. But it is my heart that we're here in West Seattle doing this first ever partnership, because we're all West Seattle folks together, and I've heard something of a mafia that we have. But in any case, it's important to all of us that nobody falls through the cracks in this. And to that end, we have organized a committee that we're going to have that is going to be run by the health department, where Planned Parenthood will lay out who we're seeing and how we're doing it, and what services are being provided. And other providers, hopefully throughout the region, will do that too. And we'll come together as a public-private partnership to ensure that we know where people are getting care and that there are no holes in that care, and that we continue to innovate to compensate, frankly, for the money we no longer have to do this in other ways. So mother being the necessity of invention here. We're really excited about this. It is our commitment that we will continue to work here and have the same wonderful outcomes in terms of unintended pregnancy prevention and education, and now with the partnership, hopefully at least as high a standard as our colleagues at the health department have maintained all along in ensuring healthy babies and moms and services that are coordinated between all of those. With our additional 6 King County locations, we hope to pick up some of the slack for other of the clinics that we may have difficulty replicating services to as we work through the budget process. But we're not prepared to announce exactly how we're solving any of that yet. That's still all being hammered out. We have already successfully transitioned in the North End. The Public Health North Clinic lost its family planning provider, and we thought that was an ideal time to make the switch over to the Planned Parenthood Northgate Center. So approximately the 300 people who were receiving family planning services only have been given Planned Parenthood referrals, and we hope to see them without missing too much of a beat. So our commitment through this special committee that we hope to be incredibly transparent with you all about is to make sure that we can, in some amount of time, vouch for that we've actually seen all the people that we were targeting to see, and that their family planning, sexually transmitted infection and disease, and maternal and health work all has been done for them, and that, that we've succeeded. If not, we are committed to pivoting to make sure that we do. So I'm extremely proud to be part of this alliance, and eager to looking forward to working with the county and the city in any way that we can figure out in this incredibly tough budget time to make this work for the women and men in the communities we serve. Thank you.
Thank you, Chris, and thank you, Planned Parenthood, for your partnership. So probably should have brought her forward first because she is integral to making this this effort work. You know, a month or 2 ago, the longtime head of Public Health Seattle and King County announced his decision to move on. And I want to thank Dr. Fleming for his service and say that that left me with a with a tough decision to make. I needed to quickly find someone who had the experience and the respect of the people within public health to appoint as their new leader. And I found that person. I was very fortunate to find that person already working in public health. It's my pleasure to introduce to you the Interim Director of Public Health, Seattle and King County, Patty Hayes.
Thank you. Thank you. It's wonderful to be here to have this special announcement with this partnership with Planned Parenthood. And as Chris said, it's been a long time partnership. We're delighted to take it to a new level. That's what I'm looking at here. And so grateful to the city and the county for the support that I feel every day in trying to address these critical problems. What I really want to do now is bring up the voices from the clinic for you. Two people who are involved here, one staff person and one client. So it's my pleasure to bring up Deanne Garden and Karen Florian, who's a client, and have them share some of their stories and comments for you. So come up and then I'll come back.
Thanks, Patty, and thanks to all of you for being here today. We certainly appreciate your interest in our program. I just wanted to share a minute or two of what it is that the Maternal Support Services does to our community. We're housed right over here with the WIC Clinic, and we have a team of really dedicated professionals. We have social workers, public health nurses, community health workers, and nutritionists who serve our community, trying to make the healthiest community that we can have. We focus primarily on pregnant women, and we see new families, new young families. In a typical day, we the nutritionists at WIC and MSS will help women, and it's particularly in the face of this epidemic of obesity and diabetes that we have. We'll teach them how to eat and make healthy choices and refer them to food banks if they need supplemental food. And that's great for the new babies that are coming along. We want to make sure that their moms are healthy and that they know how to eat properly as well when they're in this world. We do a lot of breastfeeding promotion. We have somebody in the clinic who checks out car seats. It's really basic stuff, but I don't think it's things that get done very many places in our community. So she'll tell people if they're not restraining their children well in a car seat, which is going to prevent them from being ejected from a car in the case of a car accident. We have public health nurses that are in the clinic and do home visiting services as well. And at times we are able to pick up on an escalating blood pressure that could be a lot more devastating if they wait until their next prenatal appointment. We do baby weights in the home and in the clinic. We just sort of we buffer what the prenatal care and the postpartum care and the pediatric care offers in the community. You know, in a typical home visit, I'm a public health nurse and I do home visits. I would say in a very, very typical home visit, I might go in, take a look around the environment, see a crib that has been strapped together with a shoelace and educate the parents about why that's unsafe and do some safe sleep teaching. I might check vital signs on a newly postpartum mom, tell them to open up the window, it's too hot in here for the baby, make their next WIC appointment, make their next pediatric appointment. We do a lot of work that isn't seen immediately, but I think has big ripples in our community and keeping us healthy. I wanted to bring up Karen Florian. She's been a client of ours, and she's going to have a couple words about what the Maternity Support Services has done for her. Karen?
It's not just the service here that are important, it's the staff. The staff here really care about people. They gave me hope when I needed it. When my baby was born, it had been 14 years since I cared for a baby. I was worried and I was wondering if it was normal or if I was going crazy. My friend recommended me to come here because they take the time and they really care. When I came in, the receptionist was caring and the nurse took extra time with me. Then my social worker, Carrie, she would listen to me and find resources for me to help me get better. And listening was the best part, and giving me the advice. After I talked to her, I knew there was hope for me. Carrie listened and gave me advice. I learned about postpartum depression. She told me that a lot of people go through that feeling depressed. She told me everything was going to be okay. She told me to exercise, eat healthy meals, meditate, and she took the time to listen, and that really helped me. My nurse told me to manage my nutrition with my diabetes, and I really learned a lot. My big concern was about SIDS. I was really worried for my daughter, and the nurse told me to clean the crib around, not to have anything in the crib, and to have a fan on that would help her, and the pacifier. That really helped me, and I felt better. And they gave me advice on what to feed her and to make her my own foods. And they also showed me how to spend time with her on tummy time, play music, and have her exercise. This is how I learned how to take better care of my baby and myself and my family. I just want to thank the staff for their hard work and their work and they go on beyond to help you. Thank you.
You know, I want to take your questions now, but just let me end by saying what you've heard from this is that we all know that children don't come with a manual, and that folks in the community who have questions and concerns, these programs are here to really work towards healthy families, healthy communities, and the best start for children so that we all have a brighter future. It's very important for us to maintain that eye on the prize as we go through budget difficulties and conversations about what we need to do to support families. So I just want to thank everybody again today for the support here and where we're going with a new partnership and new future here. And again, it's for the community and of the community. And that's what keeps me going every day. So with that, I'm happy to help with any questions.
I have a question for Ms. Charbonneau about, from the standpoint of West Seattle Planned Parenthood clients who will now be coming here. How do you plan to communicate that to them, and what changes might they notice besides obviously the location?
Just the location, really. The service is fundamentally the same. We are federal grantees of Title X. That's a federal chunk of money that comes to both the health department and us. So the funding mechanisms are exactly the same. And we have all operated on rules of that grant. And it's really formed the basis of how family planning organizations have put themselves together over time. So other than the location, they shouldn't see a difference.
And how are you going to
tell them? Yeah, absolutely. We're going to start announcing that we're shifting over as soon as we have it all fixed. We're thinking of a January 1 start date for the beginning. If it turns out that we need to make some sort of adjustment faster, we will. But we will be notifying people in advance, giving them maps, telling them where to go, updating our apps, all those kinds of things, so that it's clear that this is the hub. And other than this building's a lot prettier than the one we were given up, that's really the only change.
Executive Constantine, could you talk about why this clinic is getting a reprieve as opposed to any of the other three slated for closure?
Well, we have a particular group of partners who wanted to come together around this clinic. This clinic serves a lot of Seattle residents, even though it's on the county side of the city-county border. And so the city of Seattle was an eager partner, as well as Planned Parenthood being nearby and having the opportunity to move their services here and combine them in order to keep the larger suite of services available for the community. This is actually a designated route for planes going over, all the way to Vashon. The fact is that we are having similar conversations around the county with local governments, with community organizations, even with our own employees, about finding ways to keep clinics open. It is my hope that I will be able to announce before too long that we'll be able to keep at least one other clinic open.
What does this mean for county employees who are currently employed at the clinic?
I think I can have Patty or Chris answer those questions better. Go ahead.
Thanks. So for the staff here, the WIC and MSS staff are continuing, and the family planning employees will be part of those that receive layoff notices and are part of the transition after the council action in the final budget.
However, we're very much hoping some of these very qualified people might make themselves available for hire by Planned Parenthood. That would, of course, be up to them because they have terrific language and very fundamental family planning skills, and there are a lot of relationships, and we'd hope, if we can do it, to capitalize on those.
How many county employees associated with this clinic will be getting layoff notices?
I'm looking over. We'll get you the answer to that. Yep.
And then as far as the family planning staff, how many are we looking at?
We'll get back to
Okay.
you. Other questions?
Will there be any services discontinued then at this clinic location?
No, with the partnership that you've just heard about, the full range of services that have been offered here can continue.
And does the commitment from the city of Seattle, the $400,000 that you referred to, is there an expectation that will continue beyond this year?
So the proposed investment in the mayor's budget is for just 2015. He is very much looking forward to working with the county executive on the search process for the permanent director of Seattle-King County Public Health. And as that process unfolds, and as I think both the city and the county evaluate the impact of the current public health budget situation, we'll be in a better position in 2015 to evaluate that.
Thank you very much. Be available for one-on-one interviews if you'd like.
Thanks, everybody.
Thank you.
Thank you.